Hello, hi there. Welcome to the eighth episode of Crossroads. Sincere apologies. There was a big gap between the seventh and the eighth, but just to make up for that, we've got a fantastic topic and an even more fantastic guest, Dr. Haneesha. Dr. Haneesha basically has started working with Neuropedia a few years ago, almost a year ago now, and she is a developmental and behavioral pediatrician. Did her medical school and her post graduation in pediatrics from Bangalore, from one of the premier institutes there called St. John's Medical Institute in Bangalore. And during her work as a specialist pediatrician, she developed a very special interest in special needs. And so her subspecialty training was in developmental and behavioral pediatrics under the Indian Academy of Developmental Pediatrics. She's a member of the Royal College of Pediatrics and Child Health. And Dr. Haneesha is currently looking at children with developmental concerns. Her main areas of interest are high-risk neonatal developmental follow-ups, early childhood developmental diagnosis and management, school readiness evaluation and programs, and behavioral evaluations, and the list goes on. All I can say is, being one of her colleagues at Neuropedia, it has been an honor and an immense help having her at hand. And many of our patients that many of them overlap actually have been helped by her presence and her skills, and we're trying to develop new programs and build up awareness in the local population. So without any further ado, let me get Dr. Haneesha on the platform. I'll call her Haneesha for now because it becomes too long. So Dr. Haneesha, please, can you
Hi,
hear me?
Dr. Arif. Yes, I can hear you.
Right. First of all, thank you. I know you're not in the country. You're in India at the moment, and you're connected through there. So tell the audience and the viewers, where are you at the moment?
Yeah, thank you so much. I'm in India, a place called Guntur. Thank you for such a sweet introduction. Apologies for my voice. I'm down with a bad sore throat. But yeah, I hope I'm clear enough and audible.
Yeah, I can hear you clearly. I'm sure if there's any issues, the backend team might raise it in due course. So without any further ado, let's start going through the questions, Haneesha, if you're ready.
Yes, yes, I
Right. What we'll
am.
do is I have made a list of questions that I'm sure the viewers would like to know about as parents. And as we go along, there will be questions put forward by our audiences. So I'll bring that up as well. Okay.
Sure, yes.
So let me start with the first one, which is, what is a neurodevelopmental pediatrician?
Okay, so like the name says, it's a pediatrician who is specialized in child and adolescent development and behaviors. So we, as a team of professionals, evaluate, counsel, and provide care predominantly for those children with special needs or developmental conditions, so that we're extending our support to families and helping individualize the challenges they face in their development.
Right. So, as a neurodevelopmental pediatrician yourself, are you someone who take up general pediatric care as well, like immunizations and the colds and cough management and all that?
Yes, because we are a pediatrician, we do. But certainly, when we practiced neurodevelopment exclusively, as a choice, I prefer sending the general pediatric population back to the pediatricians who have referred them to me. But of course, yes, we are eligible to practice general pediatrics. But since this is my subspecialty of interest, I do a lot of child development and refer the general pediatrics a lot more to the pediatricians who refer them to me.
Sure. But I mean, you've been in Dubai for some time now, so you know the landscape and what kind of patients come through to you. So just tell us, what are your common referrals that come to you, and why are they referred by pediatricians to you?
Um, I think the very common ones which we are seeing is a lot of communication disorders or language delays, especially speech delay is something which we're very commonly seeing now. A lot of motor delays where they have difficulty in their gross and fine motor skills. We see a lot of children with autism spectrum disorders, with attention deficit difficulties, and a lot of difficulties in learning, which may or may not be a learning disability all the time. So this
All right.
is pretty much I would say maybe the first 5 most common things which we see regularly on the OP basis.
Right. So, if you can imagine, if I'm a parent, I want to get my child to see you for
Mhm.
whatever red flag or a symptom that my child might have. Do I have to prepare for it as a parent? Do I have to, collect my reports or speak to the teachers or anything before I come and see you?
Yes, certainly that would be great because whenever the parent comes to see us, we try to get a lot of information about the child through a very detailed discussion with the parent. So it would be great if the parent can give us a lot of information about the child right from, I would say, ancestral history. So what is very important for us is the pedigree or the family history, which we track back to 3 generations, because that gives us a lot of insight if there are any possible genetic conditions that we are dealing with and we would want to look into a similarity in the child. So it would be great if the parents can also find out a similar concern has been raised among the family members, the first, second, and the third generation. Information about the course of the birth history, like during pregnancy, if they had anything significant, what medications was the mother on, if they could bring the birth record of the child.
Yeah.
Was the child term, preterm? Did they have an ICU admission? What course did they go through during the NICU stay, and so on? And also their vaccinations, how has their growth been, because nutrition and growth plays a huge role in their development. So as the child had a good growth pattern. And of course, we do appreciate if the parent can also bring us some recordings, or sometimes they have photos to show us about certain behaviors, or certain skills which they see that this is the difficulty
Yeah.
my child has, this is how he holds the pencil as against what we're expecting. So I think that gives us a lot more information and a much easier way for the parent to present to us about the child.
Wow. That was really comprehensive. I'm sure, many of the hospitals or clinics or centers like ours, when we speak to parents and book them to see you, we always inform them to bring all the reports with them and try to get as much
Right.
information as possible to make the most of that first appointment. So if I'm a parent, again, if I'm coming to see you as for developmental assessment for my child,
Mhm.
what can I expect? Is it like, would I be included in the assessment, or I would have to sit out, or would you make me do certain tasks with my child? How does it work?
Yeah. So the developmental assessment per se happens through many sessions, I would say. The first session always is the detailed history, which I spoke about, right? I try to understand a lot about the child and also a lot about the family, right? So having the parent around gives me a lot more understanding on how is the child interacting with the parent, with the caregiver, whoever's been around. And also through the assessments that we plan, I always prefer having the parent with me, because it also helps me, one, like you said, for children it's always a bit of an insecurity because they just see us the first or the second time, so they're not really their
Mm,
best self. So having a parent along gives them a lot more security and be their best. We also get to have a lot of observation on the child's behaviors or skills, and sometimes the parent also tells you that, okay, this is not how the child is actually at home, or this is exactly how the child is at home, or the parents sometimes are surprised that, oh, we've never tried this activity and I'm surprised the child actually has this skill. So the assessment goes on through multiple sessions because it gives us a longer time to observe and understand the child a lot better.
mm,
So I'm expecting the parent to understand that it's going to be multiple sessions. We're going to have the
mm.
parent on board with us when we do the assessments. And a lot of times I also talk to the parent on what I'm doing or what I'm observing, because it gives a lot more insight to the parent on what is happening in the process of the assessment.
I mean, this is what we get from parents when we refer these children to you. They say, one is, why is it so prolonged? Why are there so many sessions for developmental assessment? Why is it so expensive? At times they say that, but the amount of effort that goes into it, the time, the analysis that you do after the assessment, I think there's a lot to it than just saying, okay, I'm going to make a developmental assessment for your child based on a criteria. It a lot of analysis and a lot of homework goes into it, isn't it, Dr. Hanisha?
Absolutely, absolutely. Because, like you rightly said, it's a lot of amalgamation of information from what the parent has told us, what we have observed. We also have a part of these assessments sometimes which we do it in school. So,
Yeah.
what have I observed in the classroom? What is the assessment results that are coming up? So, trying to bring these all together, because most often we also see children have a very different behavior, especially when it's a different setting event. So in a 1:1, when they're talking to me in the clinic, when everything is quiet and playful, they're a lot different in a classroom or at home.
Hmm.
So understanding the child, not just in one setting, but multiple settings is something which, again, we try and put
Important.
in our effort and do, and, try to take in that time to get the best of what we can.
Yeah. So, bringing you on to our first condition, I mean, autism and ADHD, as we know, are pretty prevalent now. We see a lot of children in our clinics, both yourself in your clinic and neurologists. Me being a neurologist, I see them regularly. And these are the two common group of conditions. And as a general rule, we believe that the prevalence has increased over the last 2 decades, I would say.
Right.
What's your take on this?
Certainly, yes, we do have evidence which has shown us that there has been an increase in numbers. Currently, like you said, autism, we are seeing as much as 1 in 44 children, and ADHD, I would say 5% globally, we see these numbers. So there are two aspects to this, which has been a matter of debate, but again, it has been proven beyond doubt that yes, we are picking up larger number of these children who have always been in the pool, because we have better criterias, we have a lot more tools that have come into validated tools, we have a lot more awareness, like people, parents, clinicians, teachers are a lot more aware of these conditions, and we're able to diagnose a lot more services. At the same time, I think the pool per se has increased in number because of what we call epigenetics, which is the way our genetic material is expressing, right? So that depends a lot on our environment, a lot about, say, pollution, the kind of nutrients we are having, the kind of chemicals we are exposed to. So I wouldn't really pinpoint on something, but we are still looking into what are these factors which are changing the way genetics are expressing, and why are conditions changing from, say, our grandparents to our parents to our and our children's generation. So
Yeah.
we are, of course, seeing larger numbers, and we are picking up a larger group because of better services.
Yeah, I mean, to add to that, even about in 70s and 80s, a lot of these children who had pervasive features were put, especially in the US, they had this ICD or diagnosis called mental retardation, and
Right.
many of these kids were put into that category, and therefore the children on the autistic spectrum or autism in those days were not as many because they were just put under the MR or the mental retardation bracket. And the second thing I tell parents is that autism is not rare. As you said, 1 in 44. That is, if you have a school of, say, 3,000 children, which is an average size school, you're looking at 60 kids who have either
Yes.
mild or moderate level of autism. So it is not a small number. We're looking at a big chunk of the childhood population in the region. Yeah.
Right.
Right. We'll move on to the next one, which is how would this help my child? So I bring my child to you because I'm worried about a single domain of developmental delay in my child. And the child comes to you, you've made an assessment, but how would that assessment help me and my child?
So, when I say doing a developmental assessment, we're trying to understand the overall development of the child. Because, yes, the concern may be in one area, but a lot of times it could be interlinked, right? Or whatever the parent brings up could just be a symptom of some underlying bigger condition, which may or may not have been picked up by the parent. So, like, say, for example, something like an autism spectrum disorder, 90% of the time, parents come saying that my child has a speech delay. They may not really pick up the socio-emotional or communication difficulties the child has, which is again interlinked to language. So having a comprehensive developmental assessment helps me understand the child in every aspect. What are the gross motor skills? What are their fine motor skills? What is their language? What are the prerequisites to language? And are these age appropriate? The way they are playing, imitating, behaving socially and emotionally. How are their cognitive or understanding and intellectual abilities? So when we have a complete understanding of the child and the environment in which the child is, has the child had an opportunity to develop these skills? So that gives us a better perspective into what we are looking at as a diagnosis. Like I said, is it purely a speech delay, or am I looking with something like an autism spectrum? And plan what further do I need to confirm the diagnosis, if at all there is. And it helps us build a more unique plan, because now we know, okay, these were the skills which were deficit or difficult, and these are the strengths that your child has. So how do I plan a program individualized to your child so that I can use the strengths and help them overcome these challenges that they're facing?
In my practice, Hanisha, I mean, I've seen parents who like undervalue or underestimate the value of a full assessment, and they move on to straight therapy. So my child cannot talk, let me go to a speech therapist. My child cannot walk, let's start physiotherapy. So instead of doing a thorough assessment and getting to the bottom of the problem, they straight away decide, okay, for financial reasons, for time, resources, whatsoever it may be, to go to the therapist straight away and start the therapies. And then they come back 6 months later saying, we are not seeing an improvement. Obviously, they're missing something there, isn't it?
True, true. Like you rightly said, sometimes they fail to understand. I think, again, I would want to bring forth that neurodevelopment is more like a ladder, right? So you have to go through every step. You cannot really jump to the level you're expecting. And
Yeah.
in an easier way of expressing, the developmental assessment helps us understand where your child is in this ladder in different aspects, not just one, and it may not be even. So that gives us a much better planning on how do I start, which skill am I building, or how do I train them accordingly. So that gives a more concrete foundation to what we're building on to the child, rather than just helping him take that big leap to go to wherever he has to.
Yeah. So what I'll do is I'll just take two questions from our viewers here, and then we'll go on to our regular chat. So Kanwal Nasir, who says, in toddlers, which behavior comes under abnormal or not normal? I don't understand that question very well, but it says, in toddlers, which behavior comes under, in inverted commas, abnormal
Mhm.
or not, in inverted commas, normal? So
Um,
I cannot decipher
I
that. If
think
you understood
abnormal
that,
or
please.
not, yeah, maybe if there is, if you could just tell us, I mean, reframe this question a bit
Yeah,
more
yeah. So I'll ask
better.
Ms. Kanwal to just retype that question, or maybe just expand that a little bit more so we understand. I'll take a second one from Mr. Balu Gadam. So, hello, good afternoon. My child is diagnosed with autism a few years ago, and he turned 13 now. I'm in the UK, and as you may be aware, that ABA is not mainstream therapy. Yes, I am. I worked there for close to 15 years, and you have to fight for funding, and special schools won't provide ABA. Now, please suggest an impact of ABA and also how food impacts children's behavior if they're on the spectrum. Right, that's a very good question, I think. So there are two parts to it, Dr. Haneesha. The first one being how ABA helps. So if you can just emphasize on that.
Yeah, thank you for the question, Mr. Balu. Now, ABA is, I would rather say yes, it's called as ABA therapy in some parts of the world, but per se, when we go into the development of ABA, it's more of a principle, right? And ABA is something which can be applied as a principle in various therapies. I can apply an ABA even as a speech therapist. So I'm trying to deliver therapy through the principles of behavior. To be in very to explain in extremely simple terms, we're working on reinforcing a very positive behavior, and we're trying to reduce and bring to bare minimum of a negative behavior, right? So it's more about reinforcing these so that we are able to help the child achieve behaviors which need to be gained and reduce whatever is not necessary or not required. So the principles of ABA may still have been applied in the therapy which he is undergoing, right? So suppose he's doing speech, or suppose he's doing an sensory integration therapy, they do use the funders or the principles of ABA so that we're working on development of behaviors of your child. And coming on to the second question, how does food impact children's behaviors in the spectrum? Per se, we do see a lot of children have gone into a lot of food regimens, but nothing has been proven. There is no scientific evidence of benefits of a particular kind of diet for these children. Per se, a good nutritious diet is what is recommended so that they have optimal amount of various macro and micronutrients which are required for the wiring, the growth of the brain, and the development.
Yeah. So, Mr. Balu, if you look at the alternative therapies and treatments in autism, I had done a presentation on this, I think, about a year ago. You can find it on my Facebook page if you do follow me. The second part of the question, ABA, I worked in the UK for 15 years, and ABA didn't exist at that point of time. And even if it did, it was in very small pockets. And even today, ABA is not as widespread as it is in the US or some of the other countries like the Middle East. But now what's happening, I can see a trend where Northern Ireland, Republic of Ireland, and many areas within UK are adopting ABA as a therapeutic modality for these children on the spectrum, along with, of course, the speech therapy and the occupational therapy. So there were a lot of skeptics of ABA they felt that it was very rigid. It's very kind of developing an animal-like behavior where you teach an animal how to react to a certain stimulus. But that's not the case. I have gone quite deep into this. We've understood what ABA principles are, and we've implemented that on hundreds of children in my last 6-7 years here in the UAE, and it's brought about significant results in this case. It forms like a foundation for children on which your other skills like your speech and your sensory integration, all that can be placed. I think we can talk about this for a few hours in the next session, but that was a very good question. I hope we've answered that. So let me go on to my next question, Dr. Haneesha,
Yes.
which is now, how do you diagnose and treat a child with autism? Now, imagine you have a child with red flags of autism coming to you for the first time. So just run me through that process, because we all know that it's not a single step. So just run me through that process of what can I expect as a new parent?
Right. So like you rightly said, it's quite a long process. The first step being a detailed history from the parent. Like I said, we get a comprehensive understanding of the child, which is added on by an examination, because a lot of times autism can be associated with neurodevelopmental disorders, which could be a part of a larger developmental condition. So we do have a good examination and observation of the child. Now, this is followed by a few sessions of assessments, which are done, which, like I said, one is the developmental assessment. We also do the gold standard autism evaluations. We prefer doing ADOS at our center to help us diagnose and understand the level of severity of the autism-related spectrum symptoms that we see. More often, we combine these with a developmental assessment because we also want to understand that, yes, the child is in the spectrum or not, but we also want to understand what's happening with the overall development and how we can help gain their various pros and cons or strengths and challenges to design the program for them. Now, once this is done, we amalgamate the information, interpret it, give you the final results. So we call back the parents, have a very detailed discussion, present the reports to them, we counsel them, because of course a lot of parents do have awareness about this, but for some it may be totally new, right? So we do have a feedback session to make them understand what this is, clear their doubts, plan or have a combined management plan with the parent. With your child benefit from, say, ABA or speech or sensory integration or a combination of these, and then we direct them appropriately. And once the process of therapy starts on, we also have reviews which happen frequently, at least once in every 3 to 4 months, where we try and understand how is the child progressing. Meanwhile, we also try and understand if the child needs any other care of specialties, like, say, vision, hearing, or a neurologist opinion, because they have associated conditions. So we do have referrals to other team members when required, so that we are able to comprehensively plan an individualized program for the child.
Yeah. So just following off from that question is the question where many people ask us is, what is an MDT or multidisciplinary team approach or interdisciplinary team approach? Please, Dr. Haneesha.
Yes, this is something which I think we very strongly believe, even at Neuropedia. When we say interdisciplinary, it's again, say, suppose for a child who has autism, who is undergoing speech therapy, ABA therapy, and integration therapy. Now, we do not work as individual teams, right? So it's not like, okay, speech does their job, OT does their job, or ABA does their job. Now, we're all trying to interlink and work or overlap in a way that we're all trying to establish similar goals, similar behaviors through your own techniques or through your own specialty. So we work understanding the child and having an understanding across or on the same, we're all on the same page. So it's not like we do not know what is happening for the child in the other specialty or the other therapies. And also when we say multidisciplinary, it's not predominantly just the therapies, but we work as a team with, say, the neurologist, the developmental specialist. Suppose we need ophthalmologist or an ENT who's going to be on board. And we also look into a larger circle of this, where we want the parent, the school most of the time, be it the nursery or the learning center, and this entire multidisciplinary professional team to be on board. Because most often we do see that, the parents are like, we don't know what's happening. I just know the child's on therapy, or the teacher is not aware of what's happening to the child. So we try to discuss, have meetings regularly with everybody on board so that we're all working on similar goals. We're trying to generalize the skills of the child and have a much better team approach for helping the child get better at most of these skills.
Yeah. Anisha, I have some parents, they come to me and say, look, I have been to a developmental pediatrician, and the only thing the pediatrician did was to observe and play with my child, and no other investigations have been carried out. How do we justify that approach to parents?
Yes, I actually get a lot of this question as well.
Yeah.
Okay, I would put it forth maybe as this way, because when I say we're trying to understand the development of the child, it's more about how their brain is functioning, right? And I do not get the functioning of the brain by just looking at how the brain looks. Like, say, just by doing an imaging like an MRI or a CT helps me understand, oh, okay, the brain looks more or less normal. But that doesn't tell me how it's functioning. So I'm going to look at a circuit and say, okay, all the wires look fairly connected well, but unless I turn the switch on and see the result, we do not know how it's functioning. So similarly, I think neurodevelopmental assessments are not meant as any blood tests or any imaging. It's more about functionally understanding the child's abilities and behaviors. And fortunately, most of these assessments are designed in a way they are play-based, because that's the best way to connect your child. Even as a parent, I think the best way to understand your child is through play. So even for us, I think that's how we get a lot of information. We connect with them. We try to get a lot of other modalities of their functioning or abilities through play. So just by observing a child play, at the end of the session, we would get a lot of information. But of course, it's not just like a free play. These are assessments which need a lot of expertise, a lot of training, a lot of practice for us to get the eye to see what we want to, or, the information capturing of what is required. And that goes in through a lot of analysis, a lot of objective scorings to give us an interpretation of the assessment results, which gets converted into the diagnosis or, whatever further is required. So I think that's something which parents may or may not see. Like you said, sometimes the parents don't even stay with the child when the assessments are carried on, to explain to them
Please,
on,
go on. Yeah.
I think it's also important as a professional for us to educate the parents on what are we doing or what are we looking at, give them that opportunity to try and understand what goes through the process, so that even the parent is on board with the assessment process.
Done anything with my child, there's no investigation, examination, I always explain to them that speak to you and take your history, because that has to be brought into the society. The other thing is, sometimes people say, okay, you saw my child and you made a diagnosis. Yes, because your eyes will not see what your mind doesn't know. So, and
Absolutely.
for our mind to know it, we've spent 20 years, 25 years training in it and seeing these cases again and again. Genetic diagnosis your child has, and the reason I made it very promptly is because I've seen a number of these, and it's a pattern that we recognize. And then I just brought this up so that if people listening here have these questions as to how we make diagnosis sometimes so quickly, that's because
A lot of times, like you said, when we've spent a good amount of time taking history and in the background, we let the child play to just observe what's happening, how are they behaving, how are they interacting, and at the end of it, when you come to a possible conclusion of this looks clinically like the spectrum and we want to confirm with the diagnosis, sometimes parents get offended. I think it would be great for parents to also understand that it has been years diagnosis in a short period of time.
And I think as an organization, as a counselor or a family counselor who would help and support these parents to kind of understand the diagnosis and take it along and help support the child moving forward. And as a healthcare fraternity, moving on, Haneesha, as a first-time parent, when should I seek advice for my infant or toddler? Or when should I be concerned about my...
Yeah, this is a wonderful question, because this is something which I always tell every parent, that in a way that be learned on what is that I want my child to learn. So like we know, development is not fixed. There is going to be a range in which your child can do certain ones, right? So always have a good understanding of what is the development, understanding of what you're expecting. So remember that there are 5 main areas. They're sitting, crawling, standing, walking, running. Their language and speech, which may not start off until 1 and above, but their ways of communicating. Are they babbling? Are they having back and forth interactions with you? How are they socially and emotionally connecting? Do they have an eye contact? Are they responding to your name? Are they sharing their, to and fro interactions with you? How is your child understanding the world? Are they recognizing strangers, recognizing family? How are they playing? How are they imitating you? So a lot of these kind of give you an understanding of your child's development, though in different areas, and overall understanding. There are a lot of evidence based, I would say, websites or apps which are available now, where you can just put in your child's age, and it will tell you what is expected for that particular age, right? And once that is done, it may also give you certain areas of red flags that, okay, your child should have done this by certain age and they are not. So that's when it's definitely where you should seek medical. Is lack of the normal milestone I'm expecting. Like I said, okay, I'm expecting my child to walk, but he's already, say, 1.5 or 2, or he's not. Or sometimes parents come saying that there is a very unusual thing happening with my child. He has this unusual mannerisms or unusual behaviors, which I don't expect my child to have. So either ways, I think whenever there is a parental concern, please be, I would reinforce saying that don't feel silly about it. Sometimes parents do ask, I feel this is silly, but I have a gut feeling something is wrong with my child. So just remember that any doubt you have is not silly. Any kind of concern you have is valid. In fact, when we get trained in medical school, there are like a list of red flags. And the first is parental concern. So any parental concern is a red flag in itself. So it's always better to explain out, seek medical advice, and then understand whether this is normal or abnormal, and then how do we go ahead with it.
Yeah. I mean, I've learned it the hard way many a times in the past, where as a resident, as a junior doctor, I ignored some assumptions and perceptions that parents had about their children. And I said, oh, that's fine, he'll be fine. And then a few days later, the penny dropped, and we actually knew that that was a starting point to the major problem that turned out later. So I've learned it in a way that anything that parents tell me that there is a problem, they say, okay, there's a certain behavior, there's a certain symptom that I cannot see as a doctor, but they tell me they have seen, or they feel, or they have a gut feeling about something. I always take it seriously. And we have to rule out conditions which can even be remotely possible before we say, before we reassure them. Yeah. Right. This is one of my hot topics on social media and other platforms, and even in written publication. And the term that I use
said, we have so much of parental education going on about this. I think we are going past the COVID, but we are stuck with the screen time pandemic. This is becoming a real big challenge, I would say, in today's era. One of the things, the first few things should be screen time. Again, maybe for viewers who time your child is spending on being exposed, time your child is being exposed to these in a day is called as screen time. Now, there are certain recommended guidelines on these, and we often see that there is a lot of discrepancy between what is expected versus what is recommended. So for children in the first 2 years up to toddlerhood, ideally the screen time expected is 0, which means they should not be exposed to any kind of screen time until the age of 2, except maybe if they're video calling a family along with a parent. Now, for children between 2 to 5, they are allowed to have 1 hour of screen time, but this is again with a parent. So it could be, say, okay, I'm going to put some rhymes, or I'm going to put some educational things. So it's going to be an interactive session with, they have not set up any particular limit on, duration, but anything that kind of replaces the child's eating pattern. Compared to this, most studies have shown that the average time a child is viewing screen in the first 2 years, it's almost 2.5 hours. And for a child above 5, it's anywhere between 3 to 12 hours, which is like way too much. And this is shown to have huge impacts on a child in every aspect, be it physically, be it in terms of their mental children. And also it's changing the wiring of the brain. And there's a lot of studies going on to look in, okay, are these actually worsening for a child who's predisposed to autism or predisposed to attention deficit disorders? Is this excess screen time making the symptoms more worse, right? So I think screen time in itself is a huge topic that we can go on and on and on. But what I would certainly want parents to take back on screen time usage, both in terms of the quality, quantity, do's, don'ts, because even when it comes to adolescents and older children, there's a lot about screen time addiction, a lot about privacy, a lot of emotional deprivation that goes on. So I think it's hugely impacting a lot of mental health as well. So as parent, we should be aware of, follow these guidelines so we can help our children minimize the kind of impact screen time has on our children.
Yes, absolutely. And I always tell parents, always think about screen time as supervised and unsupervised. As Dr. Haneesha said, if you have to give screen to your child in the first 2 years of their life, make sure it's always supervised, because not just the time the child is on the screen, but also the quality of content that they are consuming is very important, and that makes a big difference in the child's overall mental state when they start going to early school as well. So within 2 years, I would not recommend any unsupervised screen time. But as you said, supervised screen time is still permitted, because the harder you make it for parents, the more difficult it is for them to actually apply that. For example, I call screens as electronic nannies, and we as parents use them as electronic nannies to get time for ourselves. So I give my iPad to my child. Oh, I get half an hour just for myself to do something that I want to do, and and that mindset and that behavior that we've developed as parents has to be broken. Any child between 2 to 5 years, yes, they can have an hour's worth of their own screen time, but everything rest of the time it should be supervised. And above 5, or even teenagers for that matter, I think content regulation has been completely thrown out of the window. A lot of inappropriate content is consumed by teenagers, which affects their mental health moving forward. I've seen a number of cases with the current social media craze that's going on. So that's for another day. We can talk about that for length. So these are questions we've had. Dr. Haneesha, do you have any message to give to the audience and the viewers today?
Yes. So I think what I want parents to understand is to be able to invest a lot of time into your child's development, because that's something very, very important. We do have, say, a decade or two ago, we a lot of studies had shown us that there should be lifestyle changes. You should eat healthy food so that you avoid obesity later. You avoid having a myocardial infarction or hypertension or diabetes or XYZ. And we have brought in a lot of change in our physical lifestyles. So I think now over the past decade or so, or even more, we also have understood that a lot of us as adults are shaped up by how our brain has started wiring in our very early years. So a lot of attachment bonding with your child, the way you interact, the way you speak, the kind of opportunities they're exposed to, or the way the way a lot of things on parenting styles, the kind of the quality and the quantity of time we spend with them, or the kind of development that they are going through. So that has a huge impact on your child. The second
No.
thing is, a lot of parents. Yes, Dr. Arif, please go
No, no,
ahead.
please. Your second point.
Yeah.
Yep.
The second thing is, a lot of parents talk about, will my child be intelligent or cognitively okay? But I think a lot of times I'd be happier if you ask me, is my child also going to be okay in their socio-emotional quotients? So I think, because in today's world, yes, you need to be certainly cognitively fair enough to understand what's happening, but even more stronger socially and emotionally as a person to be able to go forth. So we are seeing a lot of mental health challenges across in today's world, especially teenagers, adolescents, young adults are having huge increase in prevalence of mental health disorders. And all these are tracked back to their very early childhood years. In fact, the golden period, which we talk, which is the first 2.5 years of life, through pregnancy and toddlerhood. So I think investing all your time, effort, energy, every kind of investment you want to put in, I think, is this, because that's the best you can give your child, laying a very, very strong foundation in the first few years, which will automatically start giving them a good baseline to start working on and growing up as adults, young adults, and adults who will be a lot more stronger independently.
Yeah. So now I will ask you a question, which I just came to my mind now, which is, you worked in India, you worked in Dubai now for quite some time. So give me two positives or two negatives of your working experience in these two worlds.
Okay, so
Not personally, but I'm talking about from neurodevelopmental
professionally.
practice. Yeah, yeah.
Yes, yes. So I think in terms of practice, one of the key things which I have noticed is the age range of presentation of these conditions. So in India, I have seen a lot of these children come to me in a later part of life, which is say maybe 4, 5, 6, or 7, compared to here in UAE, where I see a much more younger population present with very early signs of whatever developmental condition that they have, which in fact is good in a way because it's giving us the huge opportunity to be able to rewire their neural networks or give the best possible outcomes for these children.
Well,
Um,
that's why there is early intervention, not late intervention. So
exactly,
earlier the better.
exactly. So
Yeah,
the earlier the parents come to us with concern, the earlier we identify, start the program, the better the results
yeah.
are. So that's great to be able to bring in such a huge impact early. In terms of one of the negatives, I would say, what is a bit challenging is for a large population in India, most of the time when they come to us, there is unawareness, if I should put it as, or complete lack of knowledge on what they're coming to. So it's like, the parent walks in with a blank slate, just saying that my child has a speech delay and I don't know what's happening. You run us through the process. So we
Hmm.
go on educating them step by step. And okay, this is what we have. But I think in a population in UAE, what I see is a lot of information that they come up through social media, through Google, through a lot of things that happen. And especially for those parents who are in denial, it gets a lot more difficult to get them unlearn certain things and learn back or bring back the facts. So most of the times there's a lot of doctor shopping happening in such scenarios because they just want somebody to reassure that okay, this is not this developmental condition, and they go
Yeah.
back to that. So it takes a lot more, it's a lot more challenging because it's like half knowledge. So that's something I feel is a lot
Yeah.
more challenging here
But
because
as the social media is growing and as information is becoming cheaper and more easily available, I think one of the biggest demons we'll be fighting in the future is misinformation.
yes.
We've already started doing that. A lot of my time, when I spend, say, 20 minutes seeing a patient, a lot of that time is spent kind of debriding the misinformation that parents already have built up, either
Yes.
through directly by themselves or seeking help from an online website or an organization that has got in touch with them to give them some information. So debriding that takes a lot of time. So you rightly said.
Yeah, so I
Um,
think that's another thing which certainly would be a great message for us at the end of today's live would be to try and ask yourself that how much is this evidence based,
yeah,
how much of this is something which I should believe. And there is nothing wrong in going back and confirming with whoever is your physician you're checking with. So I see a lot of times parents feel that okay, I've read something but the doctor may not like it if they ask them. It's absolutely okay. Please ask them, I've read this, somebody told me this is the cure, or somebody told me this is what I should do or not be doing. Is this what is it? Because it may not be possible with something like say Google or social media to find this information because there's lots
yeah,
and lots and lots of information. So it'd be much
yeah.
easier to ask your professional and seek the right kind of advice on what should be done or should not be done.
Great. So, Dr. Hanisha, if I want to see you with my child and get your clinical opinion on the concerns that I have, where do I see you and how do I approach you?
Yes, so I am available at Neuropedia Children's Neuroscience Center. That's where I work. We have a clinic both at Dubai in Jumeirah 1 and at Sharjah at Sahara Healthcare Center. Um, we can share the contact details, both our email and phone number. So we can certainly, and we also have our Instagram and various social media handles at Neuropedia Dubai and Neuropedia Sharjah. So we can book in an appointment with our team and we'll be happy to help you.
Thank you so much, Dr. Hanisha. That was a very informative session. I'm sure people who connected with us have learned a lot, and they probably have many more questions to ask. But I'm sure they can get in touch with you directly to get to the bottom of that. So have a great stay. Looking forward
Thank
to
you.
having you back in Dubai. It's getting
Yes.
busier, being the first month of the year, and Happy New Year.
Thank you so much. Happy New Year to you all too. Been a pleasure being here. Thank you so much for inviting me today. I'll see you soon.
Bye, Hanisha. Take care.
Bye bye. Yes.
Bye.